Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the FIA Group, empowering plans since 1999. Now here are your hosts, the FIA Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
Hello, everybody, and welcome to another episode of Empowering Plans with the FIA Group. My name is Adam Russo. I'm the co-founder and CEO of the company. Alongside me, as always, is my great friend, my Senior VP, our General Counsel, the trusted, the well-known, the much-loved Ron Peck. Say hello, Ron.
Hello, Ron.
So, Ron, even though we love Brady, I mean, he was great in that lightning round, right?
He's not too bad. Not too bad.
But the number of phone calls, the protests outside my window. I mean, literally, I looked out my window in my office, and there was protesters saying, we want Jen. We want Jen. I said, we got to bring her back. We have no option. The emails, the calls to our HR department. I mean, the noise level, the disruptors. Jen, we didn't want to do it, but the public gave us an ultimatum, and welcome back.
Thank you. Thank you for having me.
Take that, Occupy, FIA. You're satisfied. Now you can leave.
So the wonderful Jen McCormick, the vice president of our consultant division, is here again, as always. We love to have Jen aboard. And really quick shout out to my daughter, Maeve, who is turning 4 today. It was a wonderful princess morning this morning. All the flowers and balloons and all that fun stuff and all the tutus and the tiaras. Ron, I know you have no idea what I'm talking about.
I was going to say,
neither one of you do. You both have boys.
Did you get anything for Maeve, Adam? Or?
We got really? Not bad, Ron. So, guys, before we get into the lightning round that we're going to do again today, talking about all the different type of healthcare assessments and the things that you need to look out for in 2018, we have to bring up the CVS potential purchase of Aetna. So if we wouldn't mind just going around the room here, if I can get your quick points or ideas on what you think of this merger. Is it a good idea, a bad one? It doesn't matter what your thoughts are. Let's turn it over to Ron first. Ron?
Yeah, sure. So the first thing I thought of, Adam, when I saw this was actually a few years back, the CVS purchase of Caremark. And you saw a lot of the same rhetoric then that you're seeing now. This is going to be great for the people. This is great for the industry. By bringing it all under one roof, we're going to cut costs and we're going to create savings. They were saying that about when the distributor of the drugs was also purchasing the PBM. And I don't necessarily think you saw as many negative repercussions a lot of people were worried about. You certainly didn't see all the positive repercussions we were promised. So again, there's a lot of concern about this. I think a lot of people also wonder what the impetus behind this is. You have people who think maybe CVS is trying to get more data, insurance information about people who use Aetna. And then I think also Aetna is potentially looking to see, hey, we may not know what kind of conditions these people have. We can do a better job of underwriting and determining how great a risk a person is based on their spending habits. And people say, well, if they're purchasing the drugs with their insurance, shouldn't you already know? Yeah, but what about all that over-the-counter stuff that you're purchasing? Every time you use your CVS member card, that data they have too. So if somebody's constantly purchasing over-the-counter stuff and they're getting their 50 cents off with that card, now Aetna's going to know it.
So this is the Ron conspiracy theory here.
That's it. I got my tinfoil hat, Adam.
So my first thought was right now the way that a self-funded plan is set up is that there's medical and there's prescription. Separate administrator, a separate contract, and oftentimes we have to be very careful when we're crafting the language to define whether it's covered under medical, whether it's covered under pharmacy, whether it's covered under both, and how that coordination of benefits is going to look. So one positive thing could potentially be how that coordination could be set up, because instead of working with separate entities along the way, there might create some transparency and uniformity with how benefits are being administered, particularly if it is arguable about whether it's a medical claim or a prescription claim.
So Jen sees a more positive spin to this than Ron does.
All right, sunshine.
The
Get outta
optimist.
here.
All right, so here's my take on it, right? I look at it from a perspective of the deal that United Healthcare had with Optum and how Optum was the pharmacy company, right? United is the big health insurance carrier, and how now they have competitors. Now you have Aetna that was able to have CVS as part of the deal, which is now complementing the Aetna offering, no different than Optum is complementing the United Healthcare option. So I see that's a potential new competition for United that they didn't previously had. So I like that. But what I really see here is something that I think is really important. And again, it's a positive. So sorry, Ron. I get your conspiracy. I actually believe in some of those points. But I think this one overrides that a little bit. And I would love to have your feedback on this. I've been talking about for years how we need to make the industry realize and make people at large realize that patients aren't just patients. They're consumers of services and products. And I think CVS gets that. CVS is in the consumer game, right? They bring you in, not only they try to sell you Advil, but they have, cookies, candy, chocolate, milk. They're selling you a bunch of stuff, right? Shaving cream. So they're selling you over-the-counter products as well as pharmacy products with the pharmacy center in the back. You guys all know you can go pick up your prescription, and you can also pay for diapers at the same time with the pharmacist. I always wondered that was weird. I'm like, this is a pharmacist that's ringing in milk. Like, it doesn't seem to be very efficient, but they do it. So I think what they do get is that patients are consumers of other products, which is, I think, the problem that we have with healthcare and health insurance overall is that when people go see their doctor, they're not looking at it as a consumer does. They don't feel like they're walking into a store where they want to make the right choice based on how much money they're going to spend out of their own pockets. I think that is something that the CVS executive team and the management team definitely brings to the agenda here, which I think could make a potential change. But again, I could be wrong, but I think that's something that is needed, so I see that as being a positive.
Sure. So, Adam, you struck two chords with me. First of all, when you bring that Thomas the Tank Engine bath toy and the pharmacist is ringing it out.
I don't know who Thomas the Tank is.
In the back of that person's mind, they're thinking, I didn't go to school for this, But to your other point, I actually think it does tie into what I was talking about, that they have access to more data. They could use it for good. You're right. If I'm the carrier and I know that this person either has a condition that I otherwise might not have known about, or they have some indicators that they may be headed down that path, if I have financial risk liability at stake here, I may potentially provide that person with information and with options as a consumer, because not only can I provide it to them now through my CVS branch, but additionally, it's hopefully going to keep the cost down of treating them into the future.
But don't forget right now, and Jen, I'm going to let you jump in a second. I just hit the buzzer faster than you. Right now, why does CVS offer flu shots? Because they're trying to get people to come in, and while you're getting your flu shot, hey, pick up some chocolate. Hey, pick up some, deodorant. Hey, pick up some hairstyling gel, whatever it might be. So now they can offer the flu shots, offer deodorant, etc., but also have a way of preventive care so that Aetna, the insurance company, isn't spending more money on claims because they're doing preventive care ahead of time.
Exactly.
I see that potential benefit.
Right.
Jen?
So it is a business. And one of the things, Ron, that you always talk about is what is transparency? It's having what? Information.
Sure.
So at this point, there's the potential here for having this extra information that you can use as a business. You can use to sell other things. You can use to create a relationship between the patient and their healthcare provider to make sure that they're receiving the benefits, the drugs, the chocolate, whatever it is that they need, because it's a business.
Speaking of business and speaking of needs, one of the things we're going to turn over now to Jen is talking about needs. It seems to me that too often clients automatically just come to you and say, I need XYZ. I need this. I need that. Or actually, they don't really know what it is they need. They know they have a problem, but what that solution might be is really where you come in and your team over at FIA Group Consulting can put your 2 cents in. So what I wanted to talk about to you was, and I know one of the biggest issues and the Achilles heels that you see on a daily basis, is the fact that many times a broker, a third-party administrator, or an employer plan themselves may come to you and say, hey, I need you to review my plan document. And they want us to review everything. But you've made it pretty clear based on your emails that I've seen and stuff that you've written about and spoken about over the past couple months that there are really 3 different types of assessments that you want to look at when designing your plan and reviewing your plan to see what changes you may need in 2018. And if you wouldn't mind, based on that, what are those 3 options
Sure.
and how are they different?
So there are 3 different ways that you can come about looking at a plan. We've been talking about this for years, and really this is just taking what we've been saying and put it into unique buckets so you can make an educated choice based on where you are, where your plan design is, and how far you are looking to move in the next upcoming year. So the easiest assessment is the full scope assessment, and that is the most comprehensive assessment. And that is going to be best situated for someone who is maybe new to self-funding. They're looking at everything. They want to know, am I compliant? Am I in line with what the healthcare reform requirements stand to be today? Are there any opportunities to contain costs, whether it's exclusions or subrogation language or incentives? They want everything. They want to know every possibility that they can make sure that their plan is compliant, cost-containing, and in line with what the regulations require.
So basically, you tell me there's 3 things. One is it's a compliant plan. That's, I'm assuming, Obamacare, the ACA.
Mm-hmm.
2, do they have cost containment measures, language in the plan doc to help reduce the overall spend, right? The fee away, let's say. And 3rd, you're talking about ERISA, I'm assuming.
Yep. So you need to make sure that you meet all 3 of those buckets. Do I meet all of them?
Now, what percentage of all the people that come to you actually need all 3 buckets?
Well, it depends on how far you are along in the process.
I
would
a gun
say
to your head and say a number.
So I would say 100% at the outset. Everybody needs this year 1. You need to have a full scope assessment of your plan, but maybe it's year 2, or maybe you know what your limits are based on your administrator. Maybe cost containment is not something that you're focused on next year. You just want to make sure that you're compliant because you've already put all that into your plan. You are ready to go. You know that you have the best subrogation language possible. You have the best exclusions. You are all set.
Time for a refresh.
And many times that cost containment stuff, once you put it in year 1, you're not going to see the return on investment on that till year 3 or 4. So it makes sense.
Right, let it ride.
So what would you recommend in a year 2 type analysis?
You always need to look at healthcare reform. So while the ERISA requirements may change, I don't know that they have recently, but healthcare reform is going to be where the changes are going to be on a go-forward basis. You need to make sure that we're following tax reform. How is that potentially going to impact us in the self-funded market? Make sure that we're following the regulations, the tweets, whatever the emails, to make sure that we know exactly how we can stay ahead of those changing healthcare regulations and laws. And that is why you need to revisit it each and every year to make sure that your plan is evolving and changing as the regulations change and evolve.
So when would you need that second level, the one you mentioned with ERISA, versus just having a pure ACA assessment done?
So oftentimes, if you are working with an ASO, for example, you might not be provided with a SPD. You might be provided with a booklet. And the booklet may not necessarily meet those SPD requirements. So that's when it's going to be imperative for you to have that review to make sure, this is my booklet. Does my booklet meet the SPD requirements that are required under ERISA? And that's where we can take a look at those documents that you do have that were provided and say, here's 26 categories and you meet 25, add this and you'll be all set.
So basically what you're saying to all of our listeners out there, including Ron's parents, I'm assuming. Ron, your parents listening to this?
Every time.
Good. So make sure your dad writes this down. So if you're an ASO, if you're with an ASO carrier currently, you're probably going to need an assessment done where you're looking at the ACA requirements plus ERISA.
Mm-hmm.
If you are in a second or third year with a third-party administrator, you may just need an ACA analysis done to make sure that you're current with current law, correct?
Right.
And if you're new to self-funding or if you've never done an assessment before and you literally have no idea what's going on, you want that FIA full-blown, big-time assessment, compliance, cost containment, ERISA.
Right. So the thing to keep in mind is there are guidelines for when you have to modify and update your plan, and why not apply that to the analysis for when you should actually take a look at it to see when a restate or an amendment might be appropriate. Do you have so many amendments that it's difficult to understand your plan? The same thing is true. Do you have so many programs and changes to your plan that it's time to revisit to make sure they align or they're compliant? You should be using that same analysis for whether or not you need a new document to decide whether you need a new assessment.
All right, I'll put you on the hot seat. What is the typical number of amendments that we see from our clients when they send over their plan docs? What would you say is the average number of amendments that you see?
5.
5. How many does our plan have currently? 1?
1.
1. And we're restating, I'm assuming,
Yeah.
for next year, correct?
2018, it'll be 0.
Right, it'll be 0. So, again, we're in the business, and we had 1, but it's normal for someone to have 5. What's the most you've
I
seen?
was going to say, what's the horror story? wanna
I
hear
have
this.
seen one that has 26 amendments.
Stop it.
26
How many
amendments.
times did the amendment actually override a previous amendment?
At least 15.
So the same exact provision overridden 15 times.
Yes.
So it's like a husband and wife that own the company and bickering about what the language should be, and like each behind the other's back is changing the language.
Yeah, each month you get your way and I get my way, back and
And
forth.
just switch it back and forth. Interesting to know.
But the interesting thing, too, is when you're talking about these changes, the most often changes we see relate to eligibility. We've seen over the years from employer mandate. So that is an ACA change. Also, if we have a spousal carve-out, maybe that's a cost-containing technique we can add to the plan. So looking at the eligibility alone, that overlaps the ACA healthcare reform requirements, the ERISA requirements potentially, and the ACA requirements. So it's a lot of different moving parts when one provision can be reviewed from multiple perspectives.
Well, Jen, I think you did a great job there. Folks, obviously, if you're interested in having an assessment done, feel free to contact Jen and her team at Fee Group Consulting. One last thing before we go, and I know we're going a little bit over time here today. Ron, I have to share with the audience. I am so excited to have my own doctor next month. Dr. Tremblay in Holbrook, Massachusetts. A shout out to you. We had Dr. Tremblay come in. He has his own practice, direct primary care practice here in right next door to Braintree, about 5 miles away from our office. He will be the VIP doctor for about over 20 employees at the FIA Group who've decided to make him their primary care, their direct primary care physician at a flat, low monthly rate, no copay. I'm pumped. I'm going to call and text this guy every single day. He's going to regret the day he signed me up as a patient, Ron.
In the sitcom of our lives, Adam, having our own doctor, he's now going to be a primary character in the show.
So I tell people this all the time. My kids go to a really nice school. They go to a nice Montessori school. I'm blessed that we can afford to send them there. And I'm surrounded by all these rich people who have way more money than me. Like people that work for like the Patriots and like run their like 401ks, okay? And I sit there and I'm like, I don't have a Bentley. I don't have that summer house yet. I don't have that winter home yet, that ski lodge. And they go, well, what do you have? And I go, I have my own primary doctor.
There you go.
I have my own doctor. They go, what do you mean? I'm like, no. I'm like, I'm not making an appointment. I don't have to wait 2 weeks to see my doctor. I'm not in a smelly waiting room. You guys know what I'm talking about. I literally could just call his cell and go, I want to meet with you right now. Let's meet at the 7-Eleven or let's meet at CVS. Let's meet in the parking lot. I want to show you my rash. Don't ask. Don't say anything. Do not make a joke about it, Ron. I'm just giving an example. But I think that direct primary care, it really is the future. I'm excited that we can finally offer it here at the FIA Group. And I'm really excited about sharing with our audience what we see from this experience 6 months from now, a year from now.
But just as a reminder, we do need to modify our plan so we accommodate this new program.
Right. And I did not think about that. So thankfully, Jen's on our team.
There you go.
Anything you want to add, Ron, other than that conspiracy theory you gave us about 20 minutes ago?
I'm feeling much better about things now. Thanks, guys.
Well, great. Well, everyone, thank you so much for dialing in and listening to us here at the FIA Group's Empowering Plans. On behalf of Jen McCormick, Ron Peck, and myself, as well as Pat Santos, our great executive producer, thank you so much. Have a great day.